Today we will talk about jaundice. The escalating problem of jaundice, a condition characterized by the yellowing of the skin and eyes, is unfortunately becoming increasingly prevalent in recent times. This concerning trend highlights a growing health issue that requires attention and understanding.
It is still very much an ongoing process, continuing to develop and unfold at this present moment in time. Hepatitis A is widely considered to be a common viral infection that primarily affects the liver, often spreading through contaminated food or water. However, it is crucial to recognize that there are also other distinct forms of hepatitis, specifically hepatitis B, hepatitis C, and hepatitis D, each with its own unique characteristics and modes of transmission. Among these various types, hepatitis B stands out as the most prevalent globally, posing a significant public health concern due to its potential for chronic infection and severe liver damage. Beyond these well-known forms, it is important to understand that the transmission of hepatitis can also occur through other less obvious means. For instance, if an individual undergoes a shave using razors that have been contaminated with infected blood, or if someone receives a tattoo from equipment that has not been properly sterilized and cleaned, there is a substantial risk of contracting the virus. These methods highlight the importance of strict hygiene and sterilization practices in personal care and medical procedures to prevent the spread of these potentially life-threatening liver conditions. What exactly is hepatitis? It's crucial to understand that testing positive for the hepatitis virus is one thing, and actually having the active disease of hepatitis is something entirely different. You see, when this particular virus enters our body, it has the potential to cause significant and often severe damage to our liver, which is a vital organ responsible for many essential bodily functions. This damage can lead to various health complications over time if not properly managed and treated. Sometimes this can lead to severe and irreversible damage to your liver, potentially compromising its vital functions and leading to serious health complications. The impact can be profound, affecting the liver's ability to detoxify the body, process nutrients, and produce essential proteins, thereby significantly impairing overall bodily health and well-being. If the virus has already disseminated and spread throughout the entire organism, reaching various organs and systems beyond its initial point of entry, then there is absolutely no discernible benefit or advantage whatsoever in attempting to retain it within the confines of the body. In such a scenario, its continued presence would only serve to exacerbate the detrimental effects and further compromise the host's health and well-being, making its elimination a paramount concern. It is essential to maintain a sense of calm and patience in these challenging circumstances. Unfortunately, when it comes to hepatitis, there is currently no definitive cure or medical treatment that can completely eradicate the disease from the body. This often leads to a difficult situation where individuals afflicted with hepatitis, or those who suspect they might be, frequently delay seeking professional medical attention. By the time they finally decide to consult with us, the medical professionals, the disease has often progressed significantly, reaching a stage where effective intervention becomes considerably more difficult, if not entirely too late for optimal outcomes and management. That's when they find out for the first time in their life that they are positive. It is indeed a profoundly painful and deeply saddening experience when such a medical condition manifests. The emotional and physical toll can be immense, affecting not only the individual but also their loved ones. When we specifically address hepatitis B, a significant global health concern, it's crucial to understand its implications. In the context of everyday life and routine medical checkups, there are typically two primary and widely utilized diagnostic tests that can be performed to effectively screen for and confirm the presence of hepatitis B. These tests are fundamental in identifying the infection early, which is vital for managing the disease and preventing its progression. Furthermore, for individuals diagnosed with chronic hepatitis B, there are advanced medical interventions available. Specifically, hepatic antiviral medications play a critical role in treatment. These powerful drugs are designed to actively suppress the replication of the hepatitis B virus within the body, thereby significantly reducing the viral load. By lowering the viral load, these antivirals help to mitigate liver damage, decrease the risk of developing more severe complications such as cirrhosis and liver cancer, and ultimately improve the long-term health outcomes and quality of life for patients. Understanding these aspects, from the initial emotional impact to the scientific methods of diagnosis and treatment, is essential for a comprehensive approach to managing hepatitis B. When we start treating a patient like this, the patient also expects that if they are undergoing treatment, their viral load should start decreasing immediately. Patients often want to compare their viral load results, but the other important test for which the patient usually comes to us is HB-Sag, hepatitis B surface antigen, also known as the Australia antigen. This is the test required even for immigration, and it is the test that determines whether a patient is positive for hepatitis B or not. Both tests have their own levels. Suppose today a patient gets their HPSAG test done and the value comes out to be 100. If someone is undergoing treatment and the treatment is effective, then that value should decrease from 100 to 90 to 80 and so on. It should go down, not up. That's why when you undergo Ayurvedic treatment, you are guided about your diet, you practice pranayama regularly, and both these tests are closely monitored. Gradually, as you see recovery, you reach a stage where you can live a hepatitis-free life.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma.